Dr. Freddie Ray is a critical care pharmacist and a native of Stockton, California. He was actually introduced to me by one of our own staff members and one of his longtime friends, Elaine Labson. And so Freddie received his Bachelor of Science in Biochemistry and Molecular Biology from UC Davis, the Doctorate of Pharmacy from UOP, and is a board certified pharmacotherapy specialist. That's fun to say. Freddie's clinical experience includes direct patient care within the neurocritical care, trauma, medical, surgical, pediatric, and COVID intensive care units. So he's worked pretty much in all of the big time areas in the hospital. In an effort to combat misinformation and to make healthcare information easier to understand, Freddie started a YouTube channel and an Instagram page to educate others, and you can follow him at Pharmacist RX. And I think I will look up the YouTube channel and put it in the chat so that you all can subscribe to his channel, because it'll be a great resource over time. Just like that QR code, if you subscribe, you can keep getting updated information from Freddie. So without further ado, thank you so much, Freddie, and I will hand it off to you to talk a little bit about yourself and address some of the questions that we've presented to you. And then afterwards, if anyone else has any remaining questions, they can feel free to ask those.
All right, well, thank you guys for the opportunity. I know there's a lot more things we could be doing with our time, but thank you for listening in on the conversation. I know that at the beginning of our presentation, Amy mentioned that cases are kind of downtrending, but if you look at the bigger picture, cases are really double or 3 times the amount of cases we've had since last year, just because Delta is still so spreadable and contagious. So there's a lot of new information, and before I get into a lot of your questions, I do want to share what I see on a day-to-day basis. So as Amy mentioned, I'm a critical care pharmacist, and I work in a lot of different ICU units to help the nurses and physicians. And one of my main roles is really looking at the medications, working up the patients and making recommendations, and also helping physicians take care of the patients. And a lot of what I've seen so far in all the ICUs, especially this summer, is a trend in a lot of younger patients in the ICU, mainly. So for the adult ICU, I see a lot of 30 to 60-year-olds. And actually, over the last couple of weeks, I've seen quite a few 24 and 28-year-olds. So I'm 28, so pretty much my age patients coming to the ICU. And just to give you a little bit of a picture of what that looks like, so you might have heard of patients in the ICU being ventilated. And a lot of the time, they can't breathe on their own, so we have to put them on an oxygen mask. And because they can't breathe on their own, usually they'll have to be on either a CPAP or BiPAP mask, which is a mask that helps inflate the lungs and gives positive pressure to allow their lungs to absorb oxygen. Or if they can't tolerate that or are still requiring a lot of oxygen, we'll intubate a lot of patients, and they're heavily sedated and monitored 24/7. And kind of just to paint the picture a little bit more, a lot of the patients we see on oxygen masks, once you take off the oxygen mask for a few minutes, their saturation goes from 100% oxygen all the way down to, the 70s, and so fast that they can't even eat their own meals. So a lot of the patients I see can't even eat while they're in the hospital, and they have to get their nutrition through an IV. And that's how severe COVID is as far as the Delta variant and what I actually see for the adult side. A lot of younger patients nowadays, and it's a little bit scary to see parents with young children fighting for their lives in the ICU, and also seeing a variety of patients who are not just anti-vaxxers, but those who back in May and June didn't really think COVID was a thing anymore because we were all opening up, and we're too late to get the vaccine. And right when they come to the hospital, they're saying, I was about to get it a couple of days ago, but I kind of lagged, and now they're infected. And also a lot of people who can't get the vaccine because they're allergic to something. So I'm seeing quite a different variety of people, but mainly it's people who didn't really get educated on the vaccine very well. As far as pediatrics, the youngest patient I've seen has a positive COVID result was a 7-day-old, and that was really because their parents were both unvaccinated and probably gave it to the child like right after, or the baby right after they were born. I've also seen pediatric patients who have immunocompromising diseases such as cystic fibrosis, age 12 to 13 to 15, and their parents are also weren't vaccinated and ended up in our pediatric units because they needed more treatment for their cystic fibrosis and also COVID, which made it worse. And I've also seen the casual, age 12 to 18-year-old who got exposed through school because somebody's parent wasn't vaccinated, and then their children were exposed and then spread it at school or at extracurricular activity, and those kids were also healthy. So seeing a wide range of patients from 7-day-olds all the way to 30 and 60-year-olds is kind of what we're seeing in the ICU nowadays. And it's a lot younger and a lot scarier because all of these people shouldn't really be in our ICU. And one more thing about seeing all these patients is a lot of these patients are in our ICU for a very long time. So it's a very, I would say that a lot of these patients are in the hospital for three weeks or more. And it's very hard for them because they're always on a daily basis gasping for air. And it does a lot of damage to the lungs. So in general, that's the population that I see in the ICU. And based on the therapies that we have, we try our best to, do the steroids, do the ventilation, do the lung exercises, monitoring all our patients so they're not overly sedated, and trying to get them rehabilitated and to fight COVID on their own end. Yeah. Oh, one more thing. A lot of my adult patients, actually all of my patients in general that are COVID positive, 98% of them are unvaccinated, and I've only seen like a handful of patients who are fully vaccinated, and those were those who were elderly, age 65 or older, and would qualify for a booster. So that's also another population that we're seeing. So if you do ever want to talk about, I guess with canvassing, people who might be younger and hesitant to get the vaccine, nowadays in the ICU, it's not so much the elderly people. We might see a 70-year-old or 80-year-old there once in a blue moon, but it's really the younger people, the people who are young parents, the people who went to a club or rave or something and got exposed at a party and were unvaccinated coming to the ICU. And again, these are long ICU stays, and it just takes up room for patients who need it. And then one more thing actually that happened this week, I had a patient who got a stroke. They were 50 or 40 years old, and they had a stroke because of COVID, but because our COVID unit was full, they were in the ED emergency department waiting for a bed. So we have a lot of situations like that where because our COVID patients are really sick and young and unvaccinated, they're taking up a lot of beds and resources where we can't really treat everybody that we need to treat. And so that's kind of the population that I'm seeing right now. And that doesn't include all of our other sick patients. So the hospital I work at is a level 2 trauma center. So we see pretty much everything from falls, accidents, other traumas, and things like that. And we can't really treat those patients to the best of our ability sometimes because we have a lot of resources moved to our COVID patients. So that's kind of what we're seeing right now in the population. And that's why I think that what you guys are doing with vaccines is really good. We are currently, I believe in San Joaquin, maybe 50%, and Amy can double check me. I think it's 50% fully vaccinated and maybe 60% have at least one dose. And what we've been talking about in the science community and the healthcare community is getting as many people, getting most people fully vaccinated, at least 80 to 90%, because of the Delta variant would be ideal. And the best way to get us past the pandemic status and into something more like the common cold, where we just maybe see the flu every winter.